Hello, this is one of my favorite parts of dental practice. It's probably my favorite part because at this stage of my practice, I know I can restore any case that walks in the office. The part that I enjoy is the conversation, getting to the point that you've got a patient who's had the courage to call your office on the phone. Think about how much courage that takes to call a dental office. It's a threatening situation. And now you're meeting with the patient and you're determining what is the best treatment for that patient. When analyzing a case, the very first consideration that I have is, should we try to save and restore the patient's natural teeth, or is it in the patient's best interest to extract all the teeth and place implant-supported, removable or non-removable, all-on-4, all-on-6 prosthesis? Now, at this stage of my practice, that's what I want to know first. Is it worth saving the teeth, or is there so much carnage that it's not worth saving them? Sometimes it's better to take 3 bulldozers at the curve and knock that house down and start all over. So that's the first thing I want to figure out when I'm interviewing the patient. And as I'm interviewing, that interview is so critical. And I always interview the patient in my private office before we examine them, because I want them in a non-threatening situation. And then I get to ask them these great questions. Like, one of my favorite questions is, when you called my office, you had something in mind that you wanted me to do for you. I'd love to know what that is. What do you have in mind? I don't want to begin anything that I don't know how it's going to end. The interview is so important for me to find out who's connected to the teeth. I had one guy one time that he'd had braces on his teeth from the time he was 11, and now he's 47, and the teeth were just disaster. And he said, I don't know what you've got to do, but my goal in life is to have a date with a woman before I die. So guess what happened to this guy 6 months after we finished this case? You're right, he got married. So I want to know what's motivating the person. Why did they come in? Go to the end and work backward. Where is this going? What's the end game going to be? Or is the patient going to have a final result that's functional, comfortable, aesthetic? Or would you be better off taking 3 bulldozers and knocking this thing down and starting all over? Even though I'm known for saving teeth, I find that I can get a better result, achieve a better result that's comfortable, functional, aesthetic, at a set cost, better by taking out all the teeth than restoring the teeth. If I can save them and I can get a good result and the patient can afford to do it, then normally I'd rather save the teeth. But sometimes that's not what's in the best interest of the patient. So these first cases are small diameter implants securing removable dentures. So here's another case. And what I'm trying to show you here is there may be teeth that could be saved. But when you look at it overall, this is a house that's been damaged by a hurricane. And I think, what kind of end result can I give this woman if I'm trying to save her teeth? Plus, the cost would just be phenomenal. Does she replace it with a plain denture? Now, if she's going to replace it with a plain denture, I'm not going to be the one doing it, because I don't do plain dentures without implants because of the reasons I gave a while ago. But if she wants me to do it, it's going to be a small diameter implant supported removable dentures, or all-on-4 or all-on-6. And I work with an oral surgeon to do those. And so I can give her a really nice result with implant-supported removable dentures. I couldn't have given her this result if I'd tried to save her natural teeth. Now, these are all-on-4 or 6. This woman had a bunch of old bridge work. These are all Pontics decay. So these are the implants. In this case was an all-on-4. And you can see the prosthesis here. Here's the final restoration. Prosthesis screwed into the implants. and it looks really good. You just have to take care of it.
Take your practice to the top tier. Subscribe to dentistrymasterclasses.com for an organized library of all the Dental Minute videos, plus many complete comprehensive cases and many very important articles. New cases are added weekly, only $20 per month. Subscribe now.